Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. So today I am going to explain you about the new topic, that is cancer. So that is a very important topic as a whole for each and every subject, not just for the community health nursing, but also for the medical surgical nursing or any other subjects that are covered under the nursing courses. So it's a very common, one of the most popular, and the uh, we can say that it is a disease that is affecting a millions of people every year, each year, and many of the people, in thousands or in lakhs, die from this type of disease per year. Okay, so let's start with the topic. So first of all is yes. So first of all is what is cancer? So cancer, first of all, is the introduction, is a dreadful disease which involves unbearable pain, helplessness, economic loss, poverty, and uh, causes death if not treated timely. So that's the basic introduction about this disease, that is commonly known about this disease, that it is a very dangerous disease, and till date we are not having a specific treatment for that, but we are having the alternative therapies like the chemotherapy, radiotherapy, radiation therapy, and other types of the surgical treatments. But uh, uh, all of this costs a lot of money. So if a person suffering from this disease of the cancer, he or she might become economically weak, and helplessness and some of the other type of factor, either the social ones or the physical ones, can affect that person or the patient. Okay, so cancer is an abnormal growth of cells which has ability to involve adjacent tissues and even distant organs, and eventual death of the affected patient if the tumor has progressed to the stage where it cannot be treated. So that is the basic definition. First was about the introduction, and second is the about the basic and a scientific definition, that it is the abnormal growth of the cell that is not required by the body in a, we can say that, the normal manner. So it is the excess growth of the tissues of the cells inside the body, and if this growth lead to the formation of a tumor, and if that tumor will not be treated in a proper manner, so that can also lead to death of that specific patient. Okay, so next are the major categories of cancer. So what are the major categories under the cancer disease of the cancer? So first is, different terms are here, like first of all is the carcinomas, which arise from the epithelial cells lining the internal surface of the various organ or different types of organs. There is a, we can say that the lining that is underneath the internal surfaces of the organ. So for example, the mouth, esophagus, intestines, and the uterus. So this is the type of the epithelial cell which will grow in an abnormal manner, and that category will be covered under the term, that is carcinomas. Second is the sarcomas, which arise from the mesodermal cells, and for example, the fibrous tissue and the bone. So these are the tissues that are found in these type of locations in the body, and this type of category will be, we will call it as sarcomas. The type of cancer will be known as sarcoma. Okay, next is the lymphomas, myeloma, and leukemia. Three types: lymphomas, myeloma, and leukemia, which arise from the bone marrow cells and immune systems. So these are about the types of the categories of the cancer. So there were three categories. One was the carcinomas, deals that includes the epithelial cells, and second is the sarcoma, that includes the mesodermal cells, and third is the lymphoma, myeloma, and leukemia, that includes the bone marrow cells. Okay, so that was about the category of the cancer. Next is the magnitude of the problem. So first of all is the magnitude at the world level. There are about 10 million people with the cancer in the world. About 1 million cases occur each year. Every year worldwide, cancer is responsible for 12% of all deaths globally. So according to a survey, or the basic or the different surveys, And on an average 1 million cases, that means about 10 lakh cases occur at the world level each year. Okay, and it is the second leading cause of the death, next only to the cardiovascular disease. So we can say that at the number one is the cardiovascular diseases, that is the one most leading cause for the deaths at the world level, and second one is the cancer, and that leads to the 12% of the total deaths at the world level from different types of diseases or the factors. Next only to the cardiovascular disease, which account for the 21% of the deaths. So cardiovascular diseases are responsible for the 21% deaths out of 100, and cancers results in the 12% of the total deaths. So that was about the magnitude of the problem at world level. And according to the some of the statistics, like written is, first is according to the statistics from Globocan 2008. So it is a old data. Like there are more than 12.7 million person diagnosed with cancer during 2008. More than 7.6 million died of cancer during 2.8. So you can see that a huge number of or people, that means more than 12.7 million people were diagnosed, and 7.6 million people they died because of cancer in during the year of 2008. Lung cancer accounts for 10.9% deaths annually. Breast cancer, that is the one of the major type of cancer that is found in case of female, for 12.4% deaths annually, and colorectal cancer accounts for 7% deaths annually. Okay, so that is the criteria. Sorry, the statistics according to Globocan in 2008, according to the for the disease of the cancer. Next is following in the distribution of the deaths according to different sites. So if we categorize the deaths according under the cancer for different types of cancer, lung cancer uh, is having the 18.2% out of the total 100%. That accounts for 18.2% of the death. Second is the stomach cancer, that accounts for 9.7%, and third one is the liver cancer, that accounts for 9.2%. Okay, so next third one is the five most common cancers that affect the people at a large level. That is ranking of the common cancers as per Globocan 2008 World Fact Sheet June 2010 section of cancer information. So it is a report that what are the five major types of cancer that affects the persons at large level. So most frequent cancers in males and females in the world is, first is in case of males, the number one cancer that affects the gender of the male is lung cancer, and in case of females is the breast cancer. So I will suggest you that you must learn these the priority according to the priority of the different types of location in which the cancer is affecting the person, either the male or the female. It is frequently asked in the viva questions by the external examiners that which is the foremost type of the cancer that affects the male, and in case of female, and that is also I can say that the type of question that can be asked in any type of entrance exam. So you must learn it in the you can say that you must follow this. Okay. Second is the, in case of males is the prostate cancer, and in case of female is the colorectum, and in third is colorectum in case of males. That was second in the case of female, but that is third in case of uh, sorry, that is third in case of uh, males. Next is the cervix uteri, that is in case of females. Next is fourth, stomach cancer in case of males, and next is fourth is the lung cancer in case of female. So lung cancer is the top type of cancer that affects the male, but in case of female, it is at the number 4. Next is the fifth and the last one is the liver cancer that affects the male, and the stomach cancer that was in the at the fourth number, but in case of female, it is in the fifth number. Okay, that is about the ranking of the common cancer that affects both the genders or the sexes, either male or the female. Next is the statistics at the India level. So what are the main statistics? So at the India level, prevalence, that is the total number of the cases, that is 2.0, 2.5 million in 2008. That's the old data. New cases occurred, that is 9.4 lakh cases during the year 2008. So we can say that about 1 million cases occur each year in India. 4.3 lakh were males and 5.1 lakh were females. And next is cancer deaths, that is 6.3 lakh total number of the cases, cancer deaths. So 3.21 lakh males and 3.12 lakh females. So that was firstly it was about the new cases. Then above this was the prevalence, that is total number of cases in 2008. Next is the incidence rate, the new number of the cases, 98.5% lakh, 98.5 per lakh population in 2008, and mortality rate, that is death rate, was 68 per lakh population. So out of 1 lakh cases, 68 were reported as deaths. Okay, that was our data. And last is most frequent cancers in males and females according to Global. So next is uh, next we will talk about the leading cancer sites. What are the main sites? We can say that that's mainly affected during the cancer disease of the cancer. That includes the uterine cervix in the women, and second is the oropharynx in both sexes that are attributable to tobacco consumption. So, uterine cervix and oropharynx, these are the most common sites that are affected under the disease of the cancer. Okay, so these two sites represent approximately 50% of all cancer cases. So, out of total 100%, 50% cases are just due to the location in these types of cancer is uterine cervix or either oropharynx. Okay. Next is we will talk about the one of the major issues in the one of the major states of India, that's Punjab. So in Punjab, cancer has already have strong roots in Punjab because some of the environmental conditions are not suitable for the people, and day by day the number of the cases of cancer are increasing in Punjab. So a paragraph is written here, and it was a survey was done by some of the experts or the epidemiologists in Punjab. So it was heard saying that Punjab is facing a serious problem of the cancer in the Malwa belt, and it was rumored that every other house has a cancer patient. So there was a rumor that there were a lot of patients in Punjab, and Punjab was on a cancer emergency for some time. It was rumored that. So a survey was done conducted by the Department of Health and Family Welfare in June 2005 in 4 districts of the Punjab in the Malwa belt. So that include the Muxar, Bathinda, Faridkot, and Mansa to know the number of the cancer patient in these districts. So it was found that there were total 4,53,711 cases and 164 and 420 uh, cancer patients respectively with the rate of 54.7%, 59.2%, and 28.0%, and 57.4 uh, cases per lakh population in that order. So that was a range. Another survey was conducted by the Department of Health in 2009, which 7,738 cases of cancer were found, and that are there are an estimated 20,000 to 25,000 cases of cancer in Punjab. So that was a data related to the cancer, the status of the cancer in Punjab state. Okay. Next, we will talk about the epidemiology of the cancer. What is the epidemiology, or what are the various factors that affects the disease of the cancer? So it includes, first of all, is the environmental factors. So what it includes is, first of all, is the nutritional factors. What are the various factors? So high fat diet is related to breast cancer, and high fiber diet to intestinal cancer, smoked fish to stomach cancer, and beef consumption is related to bowel cancer. So we can say that the every we can say that the bad diet is related to a specific type of cancer, or the it will affect specific organ or the organ system. Alcohol can cause liver cancer, and nutrition rich in vitamins from fresh vegetables and fruits and less consumption of the preserved, cured, and salted food has been shown to decrease the stomach cancer in the developed countries. So that is in the first two lines. The different types of sites were related with the type of the diet that will affect the that organ for the presence of the cancer. Second one is the chemical exposure. Exposure to certain carcinogens in certain types of occupations, industries, for example, benzene. Topic like the occupational cancers, I at different times I teach different types of nursing students of the GNM third year or either BSc fourth year or post basic second year. So there is a topic that is occupational cancers under the occupational hazards or the occupational diseases. So that is the type or the example linking with that type of topic is chemical exposure. So different types of worker that works daily or in on a routine manner, different types of chemicals, they are at always at the risk of having cancer due to the chemical exposure. So, for example, benzene, arsenic, and coal tar are related to cancer involving various sites and organs. Next is the occupational cancers account for 1 to 5% of all human cancers. So that is a range that is 1 to 5% of all the human cancers out of total is 1 to 5% is due to the occupational cancers. Third is the one of the leading cause that is tobacco. Tobacco either due through smoking or through chewing or any other type of inhaling or administering, it is very harmful for the body, either the lungs or the oral cavity. It will definitely cause cancer in the patient who will consume that type of tobacco in any form. Okay. For example, the larynx, mouth, pharynx, esophagus, bladder, pancreas, and probably kidney. So these are the organs that is affected by the use of tobacco. So I suggest everyone that he or she should avoid or quit smoking. Firstly, he or she should avoid, or if he or she is smoking cigarettes or consuming alcohol, she or he must immediately stop that because that can affect the body as a disease of cancer. Next is some of the biological factors. That is, first is a virus. That's hepatitis B and C viruses are causally related to the liver carcinoma, and HIV infection is a risk factor for Kaposi sarcoma, and human papilloma virus is a risk factor in case cancer of cervix. So HPV is very popular and important thing that is a risk factor in case of cancer of the cervix. Next is the parasites. Schizo Schistosomiasis in the Middle East is associated with the risk of bladder cancer. So it's a type of the parasite that can also lead to the uh, that can also cause the bladder cancer. Okay. Next is yes. Next are the physical agents. Such factors such as sunlight, radiation, heat, ionizing radiation are related to the cancer. So these are other type of factors, environmental factors we can see. So these are the factors related to the environment. The second is the factors related with the host factors. Host. So host, I would say that it is always the humans who is a host for the disease of cancer. First of all is the sex of the gender. Males are more often affected than females uh, except for the cancers of the reproductive organs. So males are more prone to the cancer as compared to females, except reproductive organs cancer. Next is age. Elderly people are more often affected. Some cancers like Hodgkin's disease, kidney cancer, and leukemia are common in young adults and elderly persons. Next, habits. Habits of chewing pan, that is, we can normally see in India, in countries like India, that people usually consume pan, zard, and tobacco. And these all are the risk factors, dangerous risk factors for placing a person at the risk of having cancer disease. In oropharyngeal cancer, excessive sex with multiple partners, early marriage, and poor personal hygiene are also associated with the cancer of cervix, and smoking and alcoholism are associated with lung cancer. So both type of addictions like smoking and alcoholism uh, that are harmful or dangerous for the lung cancer. Okay, and last one is under the host factors, the genetics. Genetic factors such as translocation of the chromosomes are found in certain forms of cancer, such as myeloid leukemia. So it is seen in different types of surveys that a genetical disorder can also lead to the cause of cancer. And third, there is a familial tendency in the occurrence of the breast cancer. It is usually seen that if a female in the family is having a breast cancer, so it is obvious of the that other females that is we can say that the cancer can be we can say that transfer from one generation to another. It is there is always a risk, so we have to be very aware about this thing also. And those with blood group A are most affected with stomach cancer than those with the other blood groups. Okay. Next is prevention and control of cancer and nurses rule. So prevention and control. So how can we prevent and control the cases of the cancer? So there are four types. That is primordial, primary, secondary, and tertiary prevention. So first of all is the primordial prevention. It includes primordial prevention includes firstly the two types of strategy. One is population strategy, and second one is the high risk strategy. So firstly, we will talk about or discuss about the population strategy. The measures in this concentrate on the modification or elimination of risk factors among population group. For example, people can be made aware about protecting from carcinogenic substances exposure and about danger signs of cancer by health education. So, what is population strategy? Is the in this there is no we can say that the group that is on the risk. We generally, in general, educate each and every member of the society or the community for the prevention of the cancer or avoidance of the substances or the carcinogens, that is the consumption of we are awareing the people that they should not consume any type of the carcinogen that can cause cancerous disease in any human. So that is the type of population strategy. That means regardless of the religion, caste, culture, or the high risk strategy, we are involving each and every people and educating them about different types of carcinogens and how they can prevent themselves from different types of cancers. So that is population strategy. So in which we also tell them about the dangerous signs of the diseases or the cancer. Next is primordial prevention. Whenever there is a word that is primordial prevention, always remember that it is linking with the avoidance of the negative habits. So, in high risk, in the population strategy, we always tell people to avoid the different types of the things that can be harmful and that can cause cancer. Okay, so that is the primordial prevention. Okay, next is high risk strategy. This involves the measures for the prevention of the cancer, and nurse can educate and refer women for screening of cancer. Cancer education should be directed to the high risk groups in this, and high risk group include. So, in the population strategy, we were involving each and every person. In this also, we will involve each and every person, but firstly, we will involve the persons who are at the high risk. So, who are the persons who will be at the high risk for having the cancer disease? That is the women in the high risk group, such as sex workers for the cancer cervix, and screening of the women having multiple sex partner. They are also at the risk of having cancer. And then screening of the women having bleeding disorders related to the menstruation, and screening of the chronic smoker for the lung cancer, and pap smear screening for the women at the beginning of the sexual activity and thereafter 3 years of cancer cervix, and mammography of the woman if they are symptomatic or have a family history of early onset of breast cancer, and breast self-examination by women themselves for or by a physician to detect breast cancer at an early stage. So this is the type of high risk strategy, and how would we deal with it is clear under this that the chronic smokers and the multiple sex partners, the person who is having multiple sex partners, so these and the other types of persons are at the high risk, and we will involve all of them in a group and will provide the education services. Okay. Next is about the primary prevention. So in this, if the primordial prevention fails, then we have to do the primary prevention. So what we will do in this is health education and immunization. So firstly, we will educate the people regarding the disease of the cancer. For example, firstly, cancer education regarding the warning signs of the cancer to the high risk group specifically. Okay, so we will tell the people about the various types of the warning sign, that what are the various types of signs that are included, that by which we can assess that either a person is on the risk of having the disease of the cancer, he or she might be getting any type of disease. So there are some of the cancer signs that we have to involve and tell the people under the primary health education or the primary prevention. What are these is firstly a lump in the breast or hard area in the breast. Second, a non-healing ulcer of more than 2 weeks duration. Third is a change in wart and mole. And either if there is a presence of the mole and it is changing in a shape and size, either the pus is filled in the mole or the wart. Okay, so that can be also be a cancer sign. Next, a persistent cough or hoarseness of the voice and lump in the testicle, excessive blood loss during or in between menstruation period or bleeding after menopause. Next is bleeding from any natural orifice, that is rectum, urethra, or vagina, and unexplained loss of weight, and a persistent change in digestion of the bowel habits and difficulty in chewing or swallowing. So these are the number of the we can say that the warning signs. If any of these signs is present in the body of the we can say that the body of the person, the human or the host, so that can lead to the you can say that there may be the presence of the cancer. Okay. Next is health education to people regarding the following. So apart from this health education to people, we can also provide the health education like maintain personal hygiene of the genital area, regular exercise should be done, and hazards of alcoholism and smoking, and avoid the consumption of tobacco and pan that are the carcinogens for the cancer. So that must be avoided. Okay. And apart from this, BSE should be conducted, that is breast self-examination must be conducted every month and a week after menstruation. Testicular self-examination, that is TSE in case of males, must also be done to check for the presence of any lump or mass in the testicles. Next, educator to use fruits and vegetables at least 500 gram daily. So if we are consuming that much amount of we can say the fruits, so we will be having the some of the positive foods that we are taking the healthy foods, so that we can prevent ourselves from the uh, different types of cancer. Next, nurses can educate people regarding precancerous lesions such as those in the mouth or the early detection and prompt treatment of these lesions. If any type of lesion is present in the body, nurse can educate the person to check for the presence of any type of cancer. Okay. Next is legislative and restrictive measures. So, not just only the health education will be helpful in prevention of the cases related to the cancer. We have to do something more, or either the government had to make rules. Some of the rules and regulation or the legislative measures must also be used. For example, the government of India enacted an act that was launched in the year of Act of 1975, that was regulation of the production, supply, and distribution Act of 1975, which came into force in 1st April 1976. All the person trading in cigarettes who have to display a statutory warning prominently. So you can see on this cigarette packet that a warning is written on the cigarette packet that if you will consume the cigarette, you can be at the risk of having cancer. Okay, but still, I'm surprised that the person after reading that warning sign, they also they don't have any type of problem in consuming cigarettes or the alcohol. So it's their habit that cannot be changed in a single day. Okay, but that can lead to the that means to say that the development of cancer in the body. Okay, so according to this act, cigarette smoking is injurious to health. That warning sign have or must be written on the every type of tobacco product or the cigarette packet. Okay, and cigarettes selling to the children must be banned, and use of the cigarettes uh, must be avoided in the public places. So these were some of the legislative measures under this act of 1975. Next is we will talk about the specific protection. So if we specifically want to provide protection to some of the person, like the occupational cancers must be prevented. So uh, all the things here are written is that X-ray workers must cover their body with a metal gown made of metal or stainless steel, so that the radiation should not affect their body or the persons regularly that come in touch with the for the formation or the production of any type of product in the factories or the mills. They must cover their body, hands, or the legs, or any type of body part that comes in with the direct exposure of that specific carcinogen. So that these must be protected by the use of PPE, that is personal protective equipment. Okay, so these things must be taken in account. Okay. Next, we will talk about the secondary prevention. So what is secondary prevention is there are two things: early detection of the cases and the treatment. Okay. So early detection of the cases, I would say that early detection of the cases is the one of the most and the main thing I would say, that if we can early detect the cancer, then only we can be able to prevent treat the cases of the cancer. Otherwise, it will be very difficult. And if the stage becomes severe, condition of the patient becomes severe, it will be not be possible to revive the patient, and at that result, at the end, can lead to the death of that specific patient. Okay, so first is the early detection of the cases. For this, we have to take the help of the various types of ARSHA workers in community and the multi-purpose health workers or any type of staff that works in the field under the PSC or the CSC. Okay, so the case detection should be done by the family history, conducting a clinical examination, X-ray of the chest, mammography for cancer chest, cytology for the cancer cervix, or any other type of method. Okay. Next, treatment. What involves the treatment is surgery, chemotherapy, radiotherapy, and immunotherapy. So these are the four things that is included under the treatment. Next is so some of the treatment strategies are written here, like for oral cancer, surgery, radiotherapy, leukoplekia can be possibly cured by the cessation of the smoking. Okay, and cancer for the cancer of the cervix, radical surgery, total hysterectomy, that is removal of the uterus, should be done. Cauterization of the discolored area of the cervix, and chemotherapy for the invasive stage. And for the breast cancer, removal of the tumor surgically, chemotherapy, radiotherapy, follow up to the detect cancer in the opposite breast, and lung cancer, for the lung cancer, surgical removal or resection of the tumor, or chemotherapy or relief of pain. Last one is stomach cancer. For that, the treatment is surgical removal of the tumor with or without adjuvant chemotherapy. Okay. Next is immunotherapy. In some cases, there is availability of the vaccine, that is cancer vaccines, to treat cancers, and prophylactic vaccines. Therapeutic vaccines are administered to cancer patients to strengthen their natural body defenses against cancer, which have already developed. We are having some of the cancer vaccines related to cancer, but that are not commonly used in India. Okay, for example, the recent hepatitis B virus vaccine. So these are some of the vaccines that are used as a preventive measure. We consider that as a vaccine in case of immune therapy for the cancer. Last one is the tertiary prevention. So what involves under the tertiary prevention is so the comments I am receiving very good comments. So some of so one is in the Punjabi, that is बहुत जानकारी भरपूर. So thank you Gagan Kang and the other persons who are watching my video. Thanks for your support. I'm really honored that you gave me the comments on my videos. I'm really honored. Thank you very much. So keep in touch and commenting me so that uh, I always feel very confident and supportive when I receive these type of comments. Thank you very much. Next, about the tertiary prevention. So it includes the two types, that is disability limitation, and second one is the rehabilitation. So if this is the stage that we have to use or the provide the services in this stage, if we are unable to stop the cancer or prevent the cancer at the primordial, primary, secondary type of stage. So at last, we have to prevent the disability limitation and we have to rehabilitate the patient. So what includes under disability limitation is this is done by intensive treatment to prevent development of the disability. Patients may develop disability due to pain, decreased vitality, loss of weight, fatigue, and comfort. And uh, in advanced stage of cancer. So this may develop immobility, activity intolerance in general, and abstinence symptoms for smoking cessation. One of the efforts in tertiary prevention is to relieve patients of above mentioned symptoms and the problem. Okay. So these are the types of the discomforts that may be felt by the we can say that the person who is suffering from the cancer. So we have to disably decrease the disability, like the loss of weight may be a problem, fatigue may be a problem. We have to rehabilitate that. Okay, so uh, next is the rehabilitation. So patients suffering from the cancer have needs rehabilitation services. Okay, so patients who have undergone surgery such as radical mastectomy, amputation of the leg, colostomy, and oral surgeries are rehabilitated. So the persons who have uh, chosen the method of the surgery or they are having the option of the surgery, so they might be in the need of the you can say that the rehabilitative care services like the uh, uh, rehabilitation services. They need rehabilitation services after amputation of the leg. They are given prosthesis and physiotherapy in order to train them to walk with prosthesis. And after mastectomy, they are given emotional support because they might feel less in the confidence. Their economical, socioeconomic status must not be good. They also need to be having the occupational therapies. And the patient with colostomy also are helped to accept their body and develop positive attitude towards self. And they are trained to use colostomy bags. Okay, so these are the different types of rehabilitation services that are to be provided by the nurses or the other medical team professionals for the patient suffering from the cancer. So that was all about the today's topic. So at the end, in the conclusion, I would say or suggest something that the youngsters on the priority basis must avoid any type of addiction like the cigarette smoking, any type of addiction like cocaine or any other type. So that are available at the local or at the any type of level, and they must also avoid alcoholism because it may also be a leading cause for the can cause the cancer. So, as a medical professional, I will suggest all of you that you should or prevent yourself from any type of addiction, so that you might prevent yourself or your family from the disease of the cancer. So I hope you must understand my today's lecture, or that will be beneficial for you. So keep in touch with me, and in the next week I will come with a new topic that will be beneficial for you. And at the last, thanks for my viewers, Gagan Khan, Sanjay Pandit, and other persons who always support me in a very effective manner. Thank you, everyone. Thanks for your love. Thank you very much.